Well,
Hey,
welcome, welcome. Now we ain't gonna come out with no who day already. Can we get a minute first before we go to the
I
who day?
said hey. I said hey, but
Oh,
since
okay.
you saying who
I thought
day,
I
who
heard that
day?
who day.
Nah, nah,
Everybody,
nah.
and their
You hearing
mama,
it now? You hearing it now? Who day?
who day, who day, who day, everybody, who day. Well, today is Wednesday. It is
It
wind
is.
down Wednesday. Y'all know who I am. Y'all know what time it is. You know what we do. We like to keep it 110% up in here. We like to laugh, cry, sing, talk, praise Jesus, whatever it is that we do, that's what we're going to do. But we're not experts at this. We enjoy doing this. Nobody gave us a certificate. This is something that we enjoy doing. We like to bring you people to get you educated, for the answers that we may not have. So, from my personal experience, we can do that. But we also like to bring you some professionals on here to talk a little bit about it. So tonight, we got somebody here. But in the meantime, in the between time, how you been, sis?
I'm good. You know, it's your girl, Shanice. It's wind down. It's what we do every week. We in the middle of the week, so we almost there. So just hold tight, hold tight. We almost a Friday, but I'm doing great. I can't ever complain. Let's just say
Good,
that. Hey
good.
AJ, thanks
What's
for
up,
tuning in.
AJ? My bad. I didn't even get over there to get that, that Bengals gear. My bad, girl. Don't hold it against me. I apologize. I apologize. But just hold on to it. They might make it another 30 years, and I might need to wear that shirt in 30 more years. So
Don't do that.
you
Don't
know,
you do that. Don't you
just
do
hold
that.
on to the shirt. Just hold on to it, AJ. It's all good. But
She
y'all
fair.
know
She
who I am.
bandwagon AJ. It's
Hey,
okay.
I'm not on the bandwagon. I'm not on the bandwagon. But guess what? Y'all already know what I'm about to do. I'm gonna help the city celebrate. How about that? How about I help the city celebrate? That's the least I can do is help the city celebrate. And on top of that, cheers to the Bengals. I mean, cheers to the Bengals. And but I'm thankful for this day and all that. Cheers to the Bengals, everybody. Cheers to the Bengals. Sip, sip.
Right, bring it home. We bring home the win.
Bring whatever it is. We gonna do what it, and we gonna do what it do. Girl, I know you still have it. That's what I just said. Hold on to it for another 30 years because they might go back.
You ain't right. You
They,
are not right.
they might go back. We'll see. Only
You
time
terrible.
after Sunday. So stay tuned. So in the meantime, in the between time, how your week been, sis?
It's been good. You hilarious.
Hey,
It's been good. It's
I like
been
to keep it
what's
100.
what
Let's
time?
laugh. Let's talk about it. That's what I do.
You know it. You know it. So yeah, the regular normal hustle and bustle, trying to get things done, trying to maneuver things, trying to situate things, trying to start new things, trying to stop old things, the
Yep.
norm, the basics,
The norm. The norm.
Yeah.
The stuff that
All while
we
trying to keep a
do.
level head.
Keeping, as the
How
song
about
say, keeping your head above water, making
exactly.
money when you can, temporary layoffs, good times. We just got to keep having good
Push it
times.
through.
We
Push it
got to
through for
keep
sure.
having good times. So I get it. Good.
How
That's,
about you? How was your week?
honey, let's see. Today is Wednesday. It's wind down Wednesday. It don't get no better than that. You know how I always say, God is good. Life is good. It's all good. And I really have no complaints at all. Going through some things that's not major but minor. You just got to get over the hump for some things. So life is
Yeah.
good. Things are coming in full circle, which I love. So no complaints at all. I'm enjoying life. I'm just enjoying life.
Yeah,
Not
you
only am
have
I
to.
enjoying life, I'm enjoying retirement too. I just wanted to throw that out there. I just
I
had
know that's right. I know that's right. Enjoy it for me one day.
I'm just enjoying retirement. So things are going good. No complaints. And Courtney is well, my family is well, which is a blessing. So, everything is good and I'm happy. I'm happy. I'm extremely happy. So let's keep it, keep our hands together because we don't like saying keeping fingers crossed. We put the hands
Yep,
together
that's right.
where we pray about it. Let me let you know
That's
that.
right.
So
That's right. You got to.
tonight, oh my Lord,
Yeah.
good. Y'all better tell everybody. This is what we
Y'all better
need
tune
y'all to do.
in. Who they gotta tell, sis?
We
Deacon who?
need to tell all the deacons, missionaries, saints, and
And
friends.
friends.
And we got a guest on here tonight. She is
Yes.
one of my favorites. Y'all know me. I always say I got a baby. These are my babies. This is my babies. This is one of my babies. This is another one of my babies. And the thing about it is when you have young people, young professionals that are doing the darn thing, you always like to invite them to come on and talk about how they got started, where they came from, and where they are now. So,
Yes.
with that all being said, people, y'all know there are a lot of people that walk around here with some bad
Listen,
breath,
and
some
y'all better
chronic
tune in.
halitosis, the teeth are messed up. They appear to not know what to do with their dental hygienes. Some people don't even go to the dentist. They don't take care of their mouth. And you and I know, and everybody knows, you should know, your this right here, your mouth and your lips, it's
Woo.
crucial. It's important to your whole entire body.
Yep.
I can't imagine chewing anything without teeth. I can't. I'm sorry. I just cannot. And I'm not knocking nobody. I'm not trying to talk about nobody, but I can't for the life of me figure out how can I eat some food that I'd love to eat without teeth.
Gumming it. Right.
Yeah, I'm
Chicken. Like
gumming
how
it,
you,
or I
you
gotta
know.
put it in a blender to get it to the point where it's gonna taste good. But heck, it's soup. So with all that being said, it's just
Right.
I want to bring one of my babies on here, and
Yes.
we're gonna let her tell you all what you
What
need
she do.
to do when
That's
it
right.
comes to your dental hygienes. Ladies and gentlemen, boys and girls, welcome Dr. Valarie Barnes.
That's
Hi,
right.
Hello, good
Welcome.
evening. Hello.
how are
How
you?
are you?
Good, doing well. How are you, ladies?
Doing well.
Great.
Thanks for asking. Thanks for asking.
Excited.
Yeah,
Excited
very
to have you
excited.
on.
Thank you.
Yes. So now that we have told the people about Dr. Valarie Barnes, how about you just let everybody know who you are, where you came from, and then we'll go right into it.
Okay. I am Dr. Valarie Barnes. I'm from Biloxi, Mississippi. I went to Xavier University of Louisiana, which is an HBCU. It is actually one of the #1 producers for getting African American students into medical school, still to this day. I also went to Meharry Medical College, which is in Nashville, Tennessee, which is also an HBCU. Meharry and Howard University are the only HBCUs where you can get a doctorate. I did my residency. I did a general practice residency also at Meharry Medical College. And I work here in a suburb of Wyoming at the Wyoming Smile Center.
Ah,
All right.
so
Go girl.
you're not even from these parts of the
No,
world.
I'm not even from these parts.
So you understand how all this thing work up here. Jesus, God bless me and you, because I'm not from here. I'm from Alabama too. So
Right. And yes, because I do remember that, you being an Alabama fan.
yes, roll tide all day long. It's very difficult to people don't understand the challenges that it is from being born and raised in the South
Mhm.
and then coming up here to all of this conservative racism stuff, because that's what it is.
Mhm.
It's a challenge, and it's an everyday challenge. And we jumping right into it. You
Mhm.
being a Black female
Mhm.
doctor in the
And
city.
let's add with a young looking face, because I look young in the face. So they always think that I'm.
There soon. Yep.
And,
I know it all too well as well.
and that's where you get them at. But
Mhm.
being a Black female here in the city of Cincinnati, state of Ohio, doctor at that, how have you found it being difficult in the medical field that you're in?
Well, I find it difficult because I have to be very careful with the way that I connect with my patients, because sometimes they forget that I am a professional, and I have to remind them, no, it's not Valarie. No, it's not Miss Barnes. No, it is
Yeah.
Dr. Barnes. Whenever I'm in clinic, you address me properly. I spend a lot of time and money and effort and intention in obtaining this degree. And the facts are that if I were a man, you wouldn't be addressing me so casually. So
Yeah, yeah.
sure that I uphold certain boundaries with my patients so that they're not too comfortable. I want them to feel comfortable enough to be able to communicate and to express their needs to me. But there's a fine line. So I will say to other young women, especially young Black women who are considering going into the medical field, that you have to assert yourself. You need to assert yourself in every space and where you are. No, you walk in, you're going to be the only one. Whenever I go to my CE courses, I'm the only one. And my hair is braided right now, but usually it's out and it's natural. Hi, welcome. I'm here, and I sit right in the front. Yes, this is who I am.
Love it.
They always say, "Oh, you're the hygienist. Oh, you must be an assistant." No, actually not. Look at my name tag. Thank you. So now at this point, it's not as offensive as it used to be. It used to be very offensive to me, but I just expect it to a certain extent, unfortunately. And so you learn how to deal with that and how to navigate those spaces a bit better.
Good. It's and
I like that, doctor. Go ahead, girl. So let them know. Put some respect on it.
I have no
Okay.
problem correcting
I ain't your girl pal.
I'm
Hey,
not.
Val. Like,
I've
nah.
even noticed, even with older African American people that I see in their 80s and up, they say, "Oh, you gonna take my tooth out? How can you do that? Like, who are you? You gonna?" Yes, baby, that's gonna be me. And then once they get the procedure done, they're so impressed and they're so, "Oh, you did it." I know, honey. This is not my first go around. Let's
Let's get this done.
Let's make it plain. Make it plain. Let them know who I am. And see, that's what I'm talking about. It's like you walk in the room with confidence. It's like my next question, with all this confidence that you have, most Black women don't have that, and they will. And this is the bad thing. And this is what I like about you and I. People don't understand that when you come from down south, you have a different type of way of thinking and doing things, because this is me. They tried to hold you back. So when you got to this point and you get here, they still trying to hold you back. I'm like, hold up, wait a minute. Let me let you know who I am and what I do, period. And yes, I'm going to be confident about who I am, because up here, I did notice that I do have doctor friends and that are females. One in particular that I know that went through some stuff here, being a Black female. White men are dominating the doctor field. There women are, there's some women, but we know the white men dominated. She really had to move out of the state to go somewhere else to practice because of a white male doctor, which is some bull crap, but
let me interject just for a moment. So I come from a very academic family. My father is an internal medicine doctor. I have another brother who also does internal medicine. I have another brother who is a general dentist. And so I'm number 4 of 5. And so I've always been looked at to be underestimated. I went and I got my dental degree solely just to prove a point to my brother that I'm just as smart, if not smarter than you, honey. So, so I'm used to that underestimated feeling. So I do think it's important. There are certain things that you have to do whenever you're in these situations, which is make eye contact. Be very upfront. Hi, no, I said what I said. Don't repeat yourself. You don't need to over-explain things either. I said what I said. You can either choose to do the treatment or not. There are there's so many other doctors that you can go and see. You don't have to be here with me, but I'm going to tell you, this is the best that is best for you, because I'm here to protect you. So it's just, it can be a bit challenging, but it's not impossible. I think that all of us, we come from different backgrounds and different experiences that help to prepare us for the things that we go through in the future.
Which is great, and not only, sometimes we have to do that. We got to prove a point to other people in order for them to see that we're not playing. I'm not joking. And it's unfortunate that there are times we got to prove that point to family members because they think the same way.
Because they think the same way. But it is a beautiful thing whenever they see, because now, my brother, he can consult with me and he asked me, well, hey, what would you do about this case? So it is lovely to see him go, oh, I didn't think about it like that. Yes, I know.
Yeah. I helped you along.
About uplifting one another. And then the thing that I love the most in my practice is whenever other little girls get to see me, because some of them, they've never seen a Black female doctor, especially maybe not even like an attractive one, and somebody that they're saying, oh, hey, I want to be like her. So I do think that representation matters. And so I take it very seriously, and I'm very glad to even have the experience and the privilege to do what I do.
And
you in Wyoming too, so woo.
Yeah, so it can be a hitter. Sometimes, I walk into a room and they're like, "You're the doctor?" Yes, I am.
I love it. I love it. I love
Yeah.
I
it.
ain't doing that, girl.
Hey, be like, hey, see it right here? Yes,
Yeah,
I
I
see
see
it
it
right
right
here.
now.
Yes,
Jack, I gotta
yeah,
print it out.
I got it. Yeah.
Because I have a male assistant, and he's taller. He's much larger than I am. So there is some confusion where they think, oh, he's the doctor, and I have to reiterate.
Mhm.
No, he wasn't explaining your x-rays to you, right? He wasn't reviewing your treatment plan with you, right? He wasn't asking you questions. Yeah, that was me. So yeah, you just gotta bring
Yeah.
them back in sometimes. So patience.
I love it. I love it. Now, my next question is: is this something that you wanted to do? Now,
Absolutely.
growing up,
Absolutely.
everybody got a different plan on what they want to do growing up. When you were growing up with all these siblings, these accolades they got going on, they this and they got the DDS or D or whatever, PhD behind their name. What is it that you wanted to do as a little girl?
Well, the thing is, whenever you have a lot of siblings, you're more competitive. You're more like, let me show, like, actually, I'm special. Let me show you something.
Yeah.
So me and my siblings, that's the thing that I'm so grateful for. They're all a lot of very type A personality. I'm talking straight A type of people. So it was always a secret competition with us. So that helps you to make you want to be better. But I had the privilege of getting to walk around the hospital with my dad whenever he would go see patients. And my dad is a very vibrant, just happy energy. He enjoys seeing patients. His bedside manner is brilliant. It's wonderful. And he really loves to put a smile on people's faces. And I wanted to do the same thing.
Good.
So that's why I say it's a privilege for me to even get to be in this career field.
Good.
So I always wanted to be like my daddy. So I'm just
Well,
glad.
thank you.
So I'm just glad that I have this, because being a dentist, it's more of like an artist, engineer. It's a mix of these things in education. Okay. And so I love the fact that I get to create and wake up and create every day. I feel very happy that I don't have to sit at a desk. Like sitting at a desk all day would not be for me. Sitting in front of a computer would not be for me, but getting to interact with people and getting just to show them a little bit of love and care, that it brings me so much joy, because there's nothing better than seeing a patient who comes in and they're terrified. They have all this anxiety. They've been made to feel bad about the way that they look, and they are, insecure. They don't even want to talk to you. And you're like, no, baby, we can fix this. Everything
Right.
you're about, we can fix this. And we can get you top of the line all the way down to whatever it has to be. So let's figure out, what does that look like for you? And so it's beautiful to see those cases start to finish, because the confidence that they feel and how good they feel about themselves, they got a whole new swag. I have a case that I did, and we did some nice crowns, some nice cosmetic work across the front. And every time he come in, it's like, what's up, Mr. Steele girl? We see you. And he just, it's a beautiful thing.
Right.
Somebody who wasn't used to smiling before.
Good.
I was gonna say, what would you feel is your most challenging patient, and like some details about it.
Well, my most challenging patients are usually those who are highly anxious, those who have trust issues, because I work with two other young ladies as well. And we'll say that they're young because they are. So I work with two other ladies, and we do our very best to give the absolute best in patient care. And so it can be difficult whenever you have a patient who's doubting you, or maybe who's had like negative experiences in the past. We have no problem with questions, but at some point I usually have to tell my, like, either you trust me or you don't. Either you believe in the truth, or you don't.
Right.
They're like, because I can't sit here and tap dance, even because there are certain patients that even if you blow glitter out of your fingertips, they are still going to be like,
Yeah,
Exactly.
and time is money.
Yeah, and you don't mess with everyone, and you can't take it. You can't be offended by that either, because certain personalities just aren't going to mesh with your style.
Right.
Those patients, they can be the most difficult, or even those who just don't take your advice. And you're like, hey, get this toothbrush, let's floss I want you to use this mouth rinse, and they just don't do it. So those are very challenging.
So my thing too is that people don't floss. Is it important, and why is it important for individuals to floss? Because I will walk around this house with a floss stick all day long, and I'm just flossing, and I can floss so much that I break the darn thing. Why is flossing so important to your teeth?
Flossing is so important because that is how you remove the deposits, the meat, the whatever that gets in between the teeth. I can actually smell on somebody that I meet on the street. I can smell it if they don't floss. I can smell it on their breath as soon as they start talking to me, because it smells like old, rancid, poisonous food. So let's talk about it like this. So you don't floss. What's going to happen is that now you're going to have inflammation. Okay. That inflammation is going to get nice and puffy. Now you have all of this bacteria that is inside of your mouth. What do you think the inflammation is going to do? It's going to start affecting the bones, the tissue, the structures that help to support the teeth. And now you have periodontal disease. Periodontal disease, whenever it's left untreated, what happens? The teeth are going to get loose and they will fall out. Eventually, whether you start getting them taken out, they will start to get loose and come out. And at that point, you're limited in your treatment options. All of this, whenever the longer that you take to get the treatment that you need, the more and more expensive it becomes. So I always tell my patients, either you get this $100-something fill-in or you get this $1,000 crown. It's really going to be up to you. Whatever you want to do. I'm not here to pressure you in anything. I'm just giving you, the information so that you can make the best choice for your body. But I'm here no matter what, baby. I'm going to be here in the park with open arms whenever you decide to come in and get your treatment.
So, and then with and you said that disease, because I probably know somebody that's got that had it or got it. So what happens if their gums are so infected?
Inflamed.
So think about it like this. So your gums are so inflamed, and then usually, typically, you end up getting like a film. So you have plaque on your teeth.
Yeah.
So that plaque can eventually turn into hardened calculus. That calculus is hard. It's like a brick. It's very, very difficult even for us to get off. So now you have that there. And eventually, if you have it there for a certain amount of time, it will turn green. It'll give your teeth like a green, dark brown hue. And all of this has a smell. Okay. And like I said, it does start to affect the bone underneath. But hey, I'll tell you something else. It starts to affect your entire body. And then you are predisposed to things like hypertension, liver diseases, colorectal cancer, oral cancer. Like you have to think like it's all connected. There is nothing that's just completely cut off. And then I could do you one better. Let's say, okay, the teeth get loose. You have a lot of inflammation inside of your mouth. Teeth are loose. Now we start taking teeth out. You don't replace them. You don't care. You're just doing whatever. How are you going to chew your food properly? You can't chew your food properly. The food can't absorb properly. So if it's not absorbing properly, now these cells in your organs and things, they're not going to be able to function at their highest capacity. What do you think happens next?
Start breaking down. Yeah.
So now we have a list of all other things. You don't have to be sick, baby. And it's very expensive, especially in the United States, to be sick.
Yes.
It's really expensive. So it's avoidable. So your teeth, it's just the beginning. It's the start of something new. I even have patients who have had severe gum disease, take out all their teeth and they say, oh, I feel so much better. I have so much more energy. I feel great. I can move around. I can do this. Yes, we make them a nice set of dentures, as nice as it can be. But all I'm saying is that it doesn't have to be like that. So prevention is key. It's very, very important to get on top.
And you just said it. So if they get all of their teeth removed because of the gum disease or whatever they had in their mouth, they get all their teeth removed and they get a whole new set put in. You got to screw them down and do all of that other stuff.
Oh, wait. I didn't say screw them down, because screwing them down, that costs more.
Well, why would
are very expensive? That costs more.
Well, why screw it down if you're going to do the same thing that you have been doing and not taking care of your teeth?
So the difference between having like implant retained dentures and regular dentures are that for patients who have severe periodontal disease and they have a lot of bone loss, those dentures are going to slide around. There's not a lot of retention. You don't have much to hold on to with that. So that becomes even more difficult. You can't eat certain foods like lettuce, salad, that's out. You're not eating that anymore. And so they get implants, and you need a certain amount of implants, but implants are very expensive. They're going to run you roughly about $4,000, $4,000 to $5,000 an implant. And you need more than likely at least a minimum of 6, 4 on the top, 2 on the bottom. Okay. And then those dentures, they can snap in and you won't have to worry about retention from the bone. But even having full dentures every year, it can be about 1 millimeter of bone that you're losing. And so think about it like this. I have 17-year-olds in dentures, in full dentures, due to drug use, due to just poor oral hygiene practices, things that were picked up from their family. So you do wonder, what is it going to look like whenever they're 60 years old or whenever they're 70
it's close to looking. It's close to looking like that right now. Unfortunately.
What do you do? And so it's very important. That's why prevention is very important. That's all I'll say about it.
So talk to us. We're going to jump in. Talk to us about this halitosis, because with all of that being said and how you're saying it goes along with the digestion. So you're swallowing that.
Mm-hmm. And somebody's, I always wonder who's kissing that. You can spread that. You could potentially spread that bacteria. So it's, and women are more likely to go to the dentist. Women are more likely to take care of themselves and to be more regimented because this is who we are. We do the hair, the makeup, the lash, we do everything. So they can give that bacteria that's just sitting in there. It can be passed around potentially.
So, is it important? How important is it to people don't brush their tongue? They don't.
Scraping your tongue is very important, especially if you are a tobacco user. Now, you should not be smoking at all, but if you do smoke, you need to scrape your tongue because you can develop something called black hairy tongue. You've probably seen it on some people. You're like, oh, the tongue looks so weird. It's like these little hair, like black little on
I've seen it.
Scrape it. So the tongue scraping is very important. And also there are research studies that show that tongue scraping also helps to reduce decay as well. So you should be brushing twice a day, 2 minutes. You should be flossing. I floss after every meal, me personally, but you should be flossing twice a day. You should be scraping that tongue. You should also be rinsing for the other tissues, like around your cheek and everything like that. So you need to get all of that nice and clean and keep it clean. And also going to the dentist twice a year, please.
So, and then I brush my tongue. Courtney actually gave me a tongue scraper, and people don't understand that there are tongue scrapers in there. There's toothbrush, but I do both. I brush my tongue and I got a tongue scraper. What about the roof of your mouth? The upper piece, because I brush
the mouth because of the way that the architecture is on the roof of the mouth. It's a little bit more difficult for deposits to stay up there. The tongue has all of these nice crevices for things just to kind of sit in. So roof of the mouth, mouthwash will help with that. But tongue scraping is necessary. I prefer a metal tongue scraper, actually. I have a metal one that I love so much. Yeah.
I got one too. Let me make sure I got it.
Let's talk about tonsil stones.
Tonsil stone, usually that has to do with diet, more than likely. Usually you're eating a lot of complex carbs or something like that is getting stuck in there. Warm salt water rinses will help to pull those out. But if you were getting those frequently and those tonsils are inflamed constantly, you more than likely need to have your tonsils removed.
Yeah, I had a friend that was
enjoyed taking those out.
I was like, what the heck? What the heck is
They're not anything bad. It just has to do with your diet. But I do notice whenever I personally don't eat as much processed food, I don't have tonsil stones.
Got it. So how do I mean, other than changing your diet, Shanice said she had a friend that had them, and I guess consistently, other than changing your diet, how can you really, you said gargle with, we're talking about gargling, salt water. Now,
warm salt water.
How does the Listerine, would that help with?
Yeah, talk to us about your feelings on that. Because your face told it all. Like,
because you and I know they make Listerine. They said they make Listerine to fight the bacteria in your mouth. So
that's your tonsils. So the thing is that if you're having a chronic condition and you're having it all the time and they're constantly inflamed, you need to have the tonsils removed more than likely, because there could be something else underlying that's causing that inflammation for whatever reason. But yeah, you need to have that removed.
So what happens if you're having tonsillitis all the time? So what I mean,
get them taken out. Get them taken out. You don't need to experience that all the time. Constant inflammation inside of your body is bad for you. That's where a lot of disease processes start, is from constant inflammation. So you usually there's something that you are consuming or doing that is causing that. But as I always say, if it's a chronic issue, it needs to be taken out, and that's it. If you can't manage it, because you can function fine without your tonsils.
Oh, I guess so, but the thing is, because Courtney sometimes have issues with her tonsils, and me personally, I don't want her to have the surgery. I don't, because I don't, I'm I got that white coat syndrome. I don't care what it is. I got the white coat syndrome.
And if it's in there, you like, it need to be there. If it's in there, it's got to be there.
The chronic inflammation does you no good, because remember, there are other structures that are around it. So what is that doing? Like, what's happening underneath there?
Yeah. Okay, because I don't know. It's just, to me, it's just kind of, I just don't want to. I mean, if there was any other kind of way to prevent that and help her, I mean,
no.
She just told you prevention.
You see what I mean? Some people don't be listening. See what I'm talking about?
We got you.
I know. It's hard. It's just hard. It's hard.
You see that in certain cultures too, to where like they don't want to have their wisdom teeth taken out. There are certain cultures where they're like, no, I need all of my teeth. But baby, if you're not keeping it clean, if it's constantly irritated, or if it's constantly infected, or if it is decayed, it has to come out.
Come
This is
out.
for your
Yeah.
overall health, because people die from dental infections. That's a real thing.
I
Because
know.
remember, this is not very far away from here or here. Your heart is right here, baby. All of this is connected, and it can make you very, very sick.
Man.
Wow.
Ugh.
Wow, that's incredible to
And yeah,
know that. I mean,
that's why I said people don't understand the mouth plays a huge role in your health. You know,
it's a lot going in that thing. Food, water, different types of drinks, different types of sodas,
wine.
coffee, tea, cigarettes for some people,
Yes, and cigarettes for some people. Yes,
It's because I know I found myself I'm like you. I my nose is really keen to certain smells. It used to be really bad. I used to be able to smell everything, but thank God I don't want to smell everything anymore. But to be in a room, this is now to be in a room. Just say you're giving.
This is true. This is true what she's talking about right now.
This is true. This is really true. So you're in your room giving it to give somebody an exam. You walk in that room and there is a foreign smell. You know that smell was not in there when you walked out, before. How can an individual, the odor and the scent coming from their mouth, it's
overpower that room.
And it does happen. But think about it like this. I'll use this analogy. If you sit around garbage long enough, or you sit around, eventually it doesn't smell to you because you don't smell it. So you get used to it because this is now your new normal. This is your baseline. It's the new thing. But even whenever I walk into a room, I'm always expecting to smell that because it's not, it's very common, honestly. And I'm expecting to see with certain people, whenever they say, "Oh, I haven't been to the dentist in 10 years," I'm expecting to see some pus or suppuration is another word to call it, that's coming out of the gums, and it's like a nice thick fluid that whenever you just press it, just comes on out, just gushes on out.
Are you squeamish? You clearly cannot be squeamish or
no.
Vomit,
those are the cases that I love to see, though. Those are my favorite cases because whenever we finish, once we get it going, once we get it done, I'm like, oh, I saved you. Look at you, brand new. You're a whole different person walking around.
Yeah, that's what's up.
So why do people and tell me how the importance of it and the whitening of the teeth? Will it damage it? Does it take the enamel off? And how often should you or anybody, not just you, I'm just saying, how often should people do whitening to their teeth? Because at the end of the day, I saw you yesterday and I look at you today and it's like, ching,
But I brush my teeth at nighttime. So here's the thing. You want white teeth? Brush your teeth at nighttime before you go to bed. That helps to keep a lot of the stains off of your teeth. Number 2, whitening long term. Yes, it can make your teeth incredibly sensitive because typically whenever you're whitening with most whitening products, what it's doing is taking that top layer of enamel off. It's not taking stain off. It's taking that top layer of enamel off. So of course your teeth are going to be more sensitive, but it doesn't make sense. Let's really get into it because I tell my patients this too. How you going to whiten your teeth and you still drinking soda? How you gonna whiten your teeth and you drinking dark wine? Like that doesn't make sense. You're in here wasting money, baby. You don't have to waste this money. So I'm not necessarily a fan of whitening products because long term it can cause a lot of damage if you are using it consistently. But brushing your teeth at nighttime will give you that nice, white, beautiful appearance. You need to brush them and getting them cleaned regularly. And avoiding coffee. And if you are drinking coffee, drink some water, swish it around your mouth right after. That will help.
So brushing right after you drink coffee is good. Brushing right after you drink.
No. I didn't say brush.
I'm asking.
Here's the thing. Depending as to if you're drinking something that potentially is acidic, that has an acidic pH, and then you brush immediately after, it's going to be more damaging. It's like throwing acid on something and now we're brushing it all around. And so that can be very damaging. So no, you really want to drink. So whenever I say, like, if you're going to have a Mountain Dew or if you're going to drink coffee, you need to drink it in one setting very quickly. You don't sip on it all day. You just drink it real quick, swish with your water. After everything that you're drinking, if it's not water, you should be swishing with water to keep that off of your teeth. Because it's sitting on your teeth, even really, really sweet wines, like sitting on your teeth, it's not good. So, and it can make your teeth very, very sensitive.
Because
Because not all water is made the same. You can actually look this up. There are certain water brands that are acidic, so you need to be drinking high pH water.
Well, let me see.
And now it would help to be drinking through a straw, correct? Would that help some as well?
That'll cause wrinkles here eventually. So yeah, but you could drink through a straw.
With your lips pursed all the time, right?
so drinking out of straws all the time, because I'm gonna tell you, this is what my sister used to do. My sister used to drink beer. And she used to put a straw in her beer all the time. So you're telling me that if I drink out of a straw so much, it's gonna cause me to have.
It could potentially. It'll increase the likelihood that you're gonna get these lines around your mouth because you're.
I got them anyway. It's like when I smile, it's like it's right there. But that's hereditary. It's like it's there.
Right. Right.
Out of a straw, but it's there. So
it'll help you guys, of course.
How bad is it to brush? Because sometimes I just go in with like just raw ingredients. So I'll go in with like raw baking soda, raw peroxide. Is that good or no?
No, don't do that.
No. Okay.
Please don't do that.
Okay.
But it will make your teeth white. But I will say, please don't do that because it's not good for your teeth long term. Okay, you should be using a nice fluoridated toothpaste. Those are the recommendations by the ADA. And I know that charcoal is big and is on trend right now. There's not a lot of research about that. There's not long-term research about the long-term effects. Remember that. Anytime that something new comes out, you always want to think, what are the long-term effects of this? So I don't recommend that either.
Oh, because a lot of people have switched to charcoal toothpaste, charcoal toothbrushes, charcoal whatever for their mouth.
Because everybody will do everything except do the right thing. It is the same thing how like people will pay for these very expensive procedures instead of just eating fruits and vegetables
correctly.
Like I don't understand why but this is where they get you, baby. Remember, it's all a money thing.
Yeah, for sure.
Being sick or not having the right, everything all together in America, it's big money. Okay. So think about it like that. Like and it doesn't have to be that way. So stop introducing all of these foreign things into your body, and let's maybe just try to do the right thing and see what happens. Or the recommended thing. I'll say that. What is recommended by the ADA? You
were saying everybody should brush at night before they go to bed. Yes. We know everybody don't do that, but the ideal thing is to brush every night before you go to bed. Now, my dentist, which I'm probably going to switch, I'm going to let you know now because I got another question for you. My dentist always recommends a certain brand of toothpaste. Do you do that, or you just say whatever?
No, not necessarily. But the one brand that I do typically recommend, because they give scholarships to Black students in dental school, is Colgate. Surprise! So I do recommend that for that specific reason. But no, as long as you're using fluoridated toothpaste, no, you're fine.
Well, I'm gonna switch to Colgate because I do crap.
That's a little Black history tip, real quick.
Black history tip.
Listen, she done laid out Black history when she first started the show, talking about
of course,
and who they do, and what they want to do.
They're getting educated on Colgate.
Yes. So now they do give their Black student scholarships. All you have to do is apply for it, and they will give you that money for the semester. Praise God.
Ah, interesting. And that's the thing. A lot of our students don't know that. A lot of our Black students don't know that. A lot of Black students don't know that. So that's good information. And it's like that's why I wanted you to come on here, because I knew you know a lot. I don't know a lot about this. This is why I have individuals that specializes in different things that can come on and talk to people, specifically our people. Specifically African American people, Black folks, because I love my people. All of them ain't right all the time, but I love my people. The thing that the fact of the matter is that when you can educate individuals on being better and doing better, mentally, physically, and for your health, that's extremely important.
Yes.
And and I told Courtney, I said, Val is darn good. And Courtney, I don't hang out with nobody else. People. I was like, there you go. There you go. She was like, what you thought? I was like, here you go.
What you thought? Come on, like what you mean?
It's always one in y'all crew There's always one.
Mm-hmm.
I mean, I love you all, and I love the fact that you are a bunch of young professionals that you're well educated, and you got knowledge about what you're doing. You just ain't doing it just to be doing it. You're doing it to help people, not just people, our people, because to lay that information out on the line about Colgate. How many people really knew about Colgate offering scholarships?
They probably didn't know that.
They didn't know. And to be that passionate, to be educated. Because a lot of people they're picking up a lot of traits and they're picking up a lot of degrees, and it's just, I just wanted to let everybody know I got a degree. It's really no benefit behind it. So that's a pretty special thing. And how long have you been a doctor?
I have been a doctor. I graduated in 2015. So it's been a little while. So finally, and I love the practice that I work at, and I absolutely love it. I love my staff. We have a lot of fun, especially if you coming in on Thursday. We're a little bit more on Thursday. So,
yeah, because it's almost the weekend. We understand.
Yeah, it's almost the weekend. So we want to talk to you. We want to get in your business. What happened? Who are you dating? Girl, we see you got the nails. So usually a lot of our favorites, they come in on Thursday, so it's a nice key day.
Yeah, sure.
So how many Black female dentists in this area do you know?
I have met a couple whenever I first got here, but I don't typically see a lot of us. So I don't know personally a lot in this specific area, but I am grateful. Like I said, I went to an HBCU. And so I am very, very grateful that I have these connections, because I have a lovely pediatric dentist friend who is out of Columbus, and she and her husband, they work up there, and he's also a general dentist. And so I have another wonderful orthodontist friend, and she is out of Georgia. And so it's great to have these people in your back pocket. I have a wonderful oral surgery friend who's from Kenya originally, and I talked to him about cases. And so it's wonderful to have these people that you can rely on, and that you can say, hey, what do you think about this? Hey, do you think that this is something I should refer? Hey, how would you handle this situation?
Right.
So it's a beautiful thing. So that's why I will say that HBCUs are important, because they help to build those connections. It's funny to me to think that I was in college with people who are now neurosurgeons, or who are into politics, or who are attorneys and who are doing very well, who have developed their own skincare lines and are dermatologists. It's such a beautiful thing. And so this is why I say that HBCUs are important, because those connections, they're just, what is it? They're in, I feel like there's a word for this. I can't think of what it is.
But they're one of a kind. They are actually one of a kind.
Definitely.
They are definitely one of a kind, and they're unique. Hey, Tracy.
Thanks for tuning in.
Thanks for tuning in. My thing is that I love HBCUs. I really do. My only thing that I don't like about HBCUs, they don't have enough money for our babies to go to school.
And it can be a challenge, but I will say, depending as to what it is that you want to do, I do think that please look into that. Please let your children go and explore that and see what that's like. That on campus, like that vibe, it's different. Being at Meharry specifically, it was like being in a place with like all like your crazy uncles and aunties. You didn't know you can get cursed out in clinic real quick. They quick to tell you, hey, these teeth look like, they look like crap. Get out of here, because you're not doing what you're supposed to. But they hold your face to the fire because they know that the world is going to hold you.
Absolutely.
That's right.
So they have to prepare you. There's nothing that somebody could say that's going to hurt my feelings, because baby, it's already been hurt. They hurt way back then.
Okay.
And that's the difference between an HBCU and a PWI.
Yeah, because the PWI, so I haven't experienced that, but from what I hear, or that PWIs, you're just a number there. At HBCUs, you are a person, and they want to see you succeed, and they're going to give you every single tool to make sure that you succeed. The pre-med program at Xavier University in Louisiana is very difficult. You have an advisor, though, that you check in with, who will check in on you and will be like, baby, I ain't seeing you where you at. It's like having a whole nother mommy there, instead of just
they care. It's a different type of care.
Just somebody, but they're like, no, where are you? Did you sign up for this? Did you get this together? You need to get that done. And so it's great to have that type of support, especially if you are somebody who's a first generation college student who doesn't know what they're doing and doesn't have anybody else to support them.
Yeah. Hey.
So kudos. What's going on, Vet? That's my sister checking in from Toledo. So we talked about the fact that, how you should brush, when you should brush. The toothpaste that I'm switching to is Colgate.
And I wanted to, and we needed to figure out, because we didn't ask, or is there specific floss that you recommend?
I personally,
yes,
I love Glide floss. So Glide, especially engineered floss. Surprise! And so whenever you use it, it's a lot more softer on your gums instead of that wax floss. Glide, I did an MBA program for a little while, and I learned all of these things about the engineers there and what they do and how like they are so into like making these really great products. So Glide, I love the Glide floss. That is the one that you should use. The toothbrushes that I recommend are Oral-B and Sonicare. I love an Oral-B toothbrush. That is actually what I use. If you brush too hard, Oral-B is good because it will light up if you are brushing too hard, and it will eventually shut off. Because people do that, they stress brush. And so a lot of recession around there, and you'll have root exposure. So Oral-B is a great toothbrush to use. And it buzzes every time that you're supposed to move to a quadrant of your mouth.
So when you say toothbrushes, they're soft, medium, I think in hard
electric.
Oh, you can get an electric,
baby. Because if you were brushing the way that you should be brushing, your arm will be hurting, your shoulder and everything will be hurting. So electric.
Everybody can afford. Everybody, let's just keep going.
There are knockoff brands that you can get on Amazon. I actually bought my son one recently because meat soup. Hello. So he has a nice little Oral-B toothbrush that I got off Amazon. I think it was like $30. But that's what he uses to help him get back there all the way in the back. Them babies, they just be rushing. They don't really take it serious. So to avoid any other additional issues, that's what he's using. So electric, but there are a bunch of other brands. It's just that Oral-B and Sonicare are the ones that are dominating the industry right now.
So if they don't do the electric brush, your recommendation is a electrical or battery operated toothbrush. That's your recommendation.
Any type is better than just the manual. But if you have to get a manual, you need something with soft bristles, okay? And you need to angle that toothbrush so it is just gently brushing right along the gum line whenever you brush, because that's typically where you'll get filled up. So, and also hit the backs of these teeth. Hey, get that inside.
Now, are you your son's dentist?
No. Because I can't.
Take that back. Professionally,
no. But in the home, yes.
Okay.
And for the babies, those little floss picks, those work very well. They take a lot of pride in using those. So he does use that. But my colleague actually is the one who works on him, because I can't take the tears. He start crying, I'm going to start crying. With other people's kids, I can be like, no, listen, we got to do this. Either you're going to do this in here with me, or I'm going to send you to pediatric dentist. And they not nice. Nice. Okay, baby, let's get this done. Come on, you big girl. We in the chair. But I actually had a 5-year-old the other day. She was so impressive. And she did so well with her 3 shots. And she didn't cry, whimper, nothing, baby. She sat there. She took it. I said, you better take a baby and get a treat. I don't care what kind of treat you're getting up. You better get a treat. And I said, the next day I texted her, did that baby get a treat? Because that made me come over there.
Right.
A brave girl, and she needs to know that she was very brave.
Yeah.
Children will sometimes surprise you, but I do find that girls do better than boys for whatever
clearly.
reason.
I'm not surprised.
It
don't matter how old we are.
Yeah, we're big girls, and they like to come and they sit down in the chair, and they're just like, okay. They don't cry. I'm telling you, them boys, any age, all the way up to 30, you can fight with them. It's a different kind of vibe.
My question is, are you accepting new clients?
Always. We are always accepting new patients. Always.
Okay. I'm going to make an appointment.
Yeah, come see us.
And I'm going to ask you this question. If an individual didn't have insurance, they don't, and they just need a cleaning, how much would a cleaning estimated?
So I can't really give you that because I don't do that. So you would have to call the office and call the front desk, 513, what is it? Is it 761-1900? And speak with one of the lovely front desk girls, and they will give you an estimate for that. We also offer Smile plans, which is like an in-house plan that is discounted if you don't have insurance and you would like to apply for it. And then there's also something called Care Credit that you can do, which is almost like a credit card type of thing. But those types of questions, I don't do that. I just do the work, so I don't know.
Right.
So I don't know.
So that ain't my lane. That ain't my lane.
Repeat that number one more time.
513-761-1900.
I know, because you don't call yourself.
Yeah, no, I don't call up there, so I don't really. But it is the Wyoming Smile Center, and everyone there, they're lovely. We have a great time, and they're very friendly. Everyone that I work with, and I have some hygienists that have been doing this for a very, very long time, and we have some newer ones too. I even have a dental assistant who's been there 36 years, and she is fantastic and really great with me. This is her only job. She's worked there since 17, and she is fantastic. Can you imagine how that makes people feel? That makes them feel good to see, the same faces over and over. And we get, just depending on the day, we may or may not get in your business. We don't know, because we like to make connections. I
know that when Sandy y'all gonna be in each other business. So I don't know how much work will get done. I'm just saying.
Hey, I'm just saying, my sister said my grandson has to get his tongue clipped. His dentist discovered and how important it is when it comes to his speech. I never knew, because the dentist said it could have affected his speech, and it didn't. People do that, I guess. I guess you would know if something like that needs to take place.
Yeah. So whenever you, so if you have children, they should be coming to the dentist about 6 months within them getting their first tooth, or, just around like their first birthday. It also helps so that they get used to being in the environment, so they don't develop all this anxiety. And don't tell your baby before you bring them in, oh, they're going to shoot you. Oh, they're going to, no, we're not. Don't tell them that. Like
trauma.
Don't give them that trauma. Don't pass that on. That is something that is very frustrating to me. I hate whenever parents come in. The parents are super anxious because that energy rubs off.
Right.
There have been times whenever we've had to ask parents, please step out, because you're making this a lot more difficult.
Exactly.
Children are very smart. They're very bright, and they know how to follow directions. They know how to listen. I promise you they do. And they like to joke, hey, I'm a big boy. I'm a big girl. So don't be putting all that excess energy on them. Just let them know, hey, they're going to come here. We're going to count their teeth. That's what we always say. I'm Dr. Barnes. I'm just going to count you. I'm just going to touch you. I'm not doing anything crazy. And then depending as to how their demeanor is, we can go from there, whether I can treat them or if I need to refer them to the pediatric dentist. And if they're special needs, if your child does have special needs, I always recommend, hey, make an appointment for them just to come in and just walk around.
Right.
For sensory. So they can just see, touch, feel. They may not even get in the chair, and that's fine. Okay. But just so that they can see, okay, what is this experience like? Then we bring them back another time. And then are you feeling it? You want to get in the chair? Can I take a look? It's a slow process, but you don't have to rush through it. That's all I'm saying. Especially
right here at Talk Radio, where you gonna get this type of information? Where you gonna get this? Where you gonna get a Dr. Valarie? You're not. So you guys need to call the numbers up there. I know you may not chime in now. You may not ask questions now. These videos, you can run them back. You can call, ask questions, but a lot of people are in certain fields are not this passionate, and it's important. Like, our world has changed so much that people are just about, well, how much money, how much I'm gonna make, instead of the actual care of a person. So, I've not heard any dentist or anyone for that matter, fact, with someone with sensory issues or a child with special needs to have that much care to, like, let's gradually slow walk this thing. I don't have to, I'm going to throw you in a chair and hold you down. Let's get this done,
It makes me cry. When I tell you, whenever they cry, I cry. Like, I don't want to cry. Right. Now, I'm a woman already. Like, I don't want y'all thinking I'm weak. Like,
right.
Cry at work.
And that's it. That's it right there. That's the important part. You have a sensitive side, and people don't. It's like you got a real great. I know you, but you got a good sensitive side. So when somebody comes in there, you know how they feel. You can see it. You can feel it when you walk in the room. And half the time,
I had a woman who came in and she hadn't been to the dentist in 8 years, and she has some issues. But baby, I told her we can fix this. She started crying. I said, no. Listen, you don't have to cry. Like, I know it might be like a release for you, but we have a start now. We have a plan. This is our plan. This is where we can go. This is regular maintenance, babe. We don't have to take anything out. We don't have to do any crazy appliance. We're gonna fix all of this. It's fine. So just giving them that reassurance to know that it's fine. That, you know, this is my job. You don't have no reason to be embarrassed. This is what I do. What do you mean?
Right. I signed up for this. What you talking
about? I signed up for this, and I honestly do like the nasty because I like to work on it. Nothing I hate cleaning people with these perfect teeth. It's boring. I'm bored.
All right, Dr. Pimple Popper, Junior.
Right. No, seriously. Whenever I saw Dr. Pimple Popper, I literally watched every single video on YouTube. Like it was like not even like a joke. So I'm just saying, because to see them go from all of this inflammation and then you see them over the next few visits and everything's healing very well. The gums are nice and pink. Their breath smells better. They feel better. Like it makes you feel we've repaired these teeth in the front. They over here, they got a little swag. Next thing you know, they got their nails done. Boom, boom. Oh, you got a little boo? Okay, tell us about them. That's your boo call.
Right. All because of the smile.
Life changes. Right.
All because of the smile.
I'm telling you, it's a whole different persona that you get to see. And it really, that's the part that makes me happy. That's why I say, you know, even in dentistry, you know, because you get some cases that are so complex that you are like, you know, I'm not the best person to help you. And you have to send them out of the door because it's more than just money. I got to be able to sleep at night. I got to be able, whenever I hit the pillow, I got to be able to say, hey, I did a good job.
Right.
I did my very best today. And there are some, unfortunately, there are some providers who don't necessarily, they're just, you know, they're just trying to get what they can get.
Get caught up. Yeah.
No, that's also why I do say, like, whenever like you're going through, if you're going to have some extreme procedures done or something that's very intense, you know, get a couple of opinions. Maybe this is your teeth.
Yes.
Get a few opinions. Say, hey, go see this specialist. I want you to go see the periodontist, or I want you to go see the oral surgeon or whoever. Go see them. Let's really talk about it and see what are the options. I have a case that I actually had to refer out to a prosthodontist. Prosthodontists, what they do are like specialized crown and bridge cases. So complex cases, like we're trying to restore a space, but there's something complex going on. And I had to refer her out. And she's like, oh, you know, I got to wait. There's a wait list. I got to wait until June. But okay, well, do you want it fixed or not?
Yeah, get it done.
There's only one prosthodontist that I know of that I actually refer to here in the state of Ohio. You know, I don't know about everybody else's work. I can't just say, hey, go see this person. The specialist that I refer to, I really believe in. I would let them work on me. So it's like, I'm not going to send you just to some wackadoodle who's going to be like, yeah, whatever. Like, I'm not doing that. Or somebody with poor bedside manner. I want you to have the best experience.
And that's saying a lot, because that's saying a whole lot, because now you're referring other dentists to your patients, because you're standing there and you're letting them know these are the people that I would allow to do work on me. You know, not just work on me.
Some crazy things. You'd be surprised. I see some things where I'll open the and I'm like, like, this is not even to the standard, baby. Like, who is this?
Why did this happen?
No, tell me. And I always ask them, no, can you tell me what their name is? Because then I go in and I look, and sometimes I reach out as a professional courtesy, and other times I'm just like, hey, you know, you shouldn't go back to that person because they don't put the same amount of care into it. And that is a very real thing. I hate to say it, but it is.
Yeah. And that's in all fields. I agree with you 1,000%.
Unfortunately, it is. So why do people gums bleed when they brush?
Because they don't floss. And they have a lot of bacteria inside of their gums, and they need to get their teeth cleaned. You have to get your teeth cleaned. I have seen one person who has not had their teeth cleaned in 10 years, but he was an avid brush flosser. Not a lot on his teeth. I was surprised. Not a cavity inside. I said, well, look at that. But I'm sure it has a lot to do with diet too. And about
how much plaque buildup did he have?
Not very much at all.
Okay.
He had some stain, but he had an electric toothbrush. He flossed twice a day. You know, he used mouthwash. Like, he was very, like, on top of his hygiene. He was somebody who was off the grid, if that makes sense.
Yes.
He's not eating a bunch of processed food and a bunch of BS like, he was eating a bunch of fresh fruits and vegetables.
Which is not going to take your teeth health down as quickly. Right. And then on top of that, he was kind of taking maintenance. He was taking care of it.
Consistency in all things. Consistency.
Yeah. He ain't eating a lot of Grippos and drinking Mountain Dew.
Right. He ain't drinking Mountain Dew, because I'm telling you, Mountain Dew is very destructive.
It's terrible.
If you notice that you're drinking soda and you have these like white spots like all over your teeth, or they start to look almost like little like yellow brown. That's that acid in that Mountain Dew, baby.
Yeah. This is my
coloration. Ugh.
But there are people that can smile. When they smile, it looks like they have
their teeth look like gray almost.
It's like caked on
like
their
jelly.
Yeah.
What's that? What is that?
So that caked on look or that thick yellow look, that is calculus. That's that buildup of plaque that gets to be really, really hard. That is calculus.
Which
and that
means
needs
you
to
don't
be
go to the dentist.
Yeah, the only way that you can get it removed is by the dentist. Like that is the only way, because if I were to even sell you the sharp tools to get it removed, you're going to cause more damage than good, and you won't be able to get it all off. There's no way. It's a technique.
Well, I'm definitely coming. You know,
Come see us.
I have to. Oh, I am. You know, my thing is, I will be calling tomorrow to see if I can schedule for next week, and because my
Thing
thing
is, me call too. I'm about to be switching over myself. They about to be
that's
mad.
what I said. I'm about to, that's one thing that I like to do. Me personally, and Courtney too. We like to make sure that we reach out to our people. You know, I would rather, and I'm not saying that my dentist has been great. I mean, he has been wonderful. I was mad when he moved from a closer location way out to Neverland. But he has been he has been outstanding as a dentist. But I think now it's time for me to switch over and move to someone, not only Black folks, you know how we are, how we operate, how we think. We know if we're scared, if we got an anxiety about our teeth, those things, why we don't come to the dentist, those things instead of just getting our money. You know what I'm saying? So it makes a difference to me to have an individual, an African American, that's passionate about what they do. Not only what they do, but you care about your patients, and you show it, and your patients see it.
But not even just that, even culturally, I understand. I have an older woman who comes to come see me. She like in her 80s. And she don't care what I got going on. You better come in, come speak to me, and come talk to me, and let me talk to you about your son, and let me see what you got. And I have to sit there and talk to her. There was one time one of my assistants, he was helping her order something off Amazon. She wouldn't leave till he helped her. And I was like, that's right. We rushing her because she don't like that. So don't rush her. So you gotta come in, you gotta say, hey, Miss Such, how you doing? Okay, yeah, girl. Okay, this because I just know that's what you do, is like a respect thing.
That makes her day.
It's a cultural thing, that's just
definitely
what it is. And if she wants to talk to me, I gotta sit there and make eye contact. Don't matter how busy I am, I gotta sit there and just, yes, ma'am, you're absolutely right. Yes, ma'am, I'm gonna do that. I'm gonna try that recipe. Yes, ma'am, you're right.
For sure.
I also want you to know that your daughter
getting my business. So you heard me getting my business.
You heard me, Mama.
Coming.
Your daughter is a bully. She be coming in my chair and be like, if you tell me I got a cavity, I will walk up out of here. She cracks me up. So let
me tell you, she wants to get an Invisalign, I guess, or whatever. You know what she wants. And I'm like,
so Invisalign is fine. Veneers are the issue. I feel like there are a lot of people who want to get veneers, but they don't understand that it is very much an investment. You're going to pay a lot of money per unit for each veneer. I don't do veneers personally because if you get it can be very complicated, and then you get married to those patients. So let's say you get veneers, then let's just say hypothetically, I'm not sure, I could be guessing. It's about $1,000 a unit. You're going to need at least 6 to 8 to make it look good. So that's $8,000, right? Okay. All right. So let's just say you get recurrent decay around your veneers. Now that's going to be potentially even double the price that you paid for it. Who are you going to be mad at? You're going to be mad at me. Like, I can't, like, it's just something that I don't love.
Don't want to get into it. Yeah, you don't want to swim in that water.
I don't even want to swim in that water. It's a lot of money to be made with that. And I totally understand, like, the look that people are going for. But you can achieve that same look with Invisalign or with braces, or even just with that, and then just a few other cosmetic things that we can do with nice composite or crowns. But no, I don't love veneers at all.
Well, hey, Robert,
I have a great doctor I referred to. I have a wonderful doctor that I referred to.
Let's just hope when I come, I mean, I don't need all of that. Just just give me a good cleaning. Just all
old fashioned, old school. You know what I'm saying? That
I'm too old to be trying to
Hollywood look. Hollywood, and to me, sometimes them veneers they look terrible. Sometimes, I mean, they try their best. It's not your real teeth.
So let's think about it like this, because some of what they're starting with. This is why I always say aligning the teeth is best before you even start that process, because they have to make it work, make it fit. So typically you end up with like this like bubbly look,
boxy,
they're too big, and you can't even close your mouth.
Yeah,
if you can't close your mouth,
look like a few church Bibles.
And I just always say, baby, why would you? You were. It's fine the way that it is, but but once again, that's the industry. It's always trying to sell you something. Trying to sell you something to tell you, hey, what you have isn't good enough. Hey, that booty that you have isn't good enough. Get a bigger one. Hey, that stomach you have isn't flat enough. Get enough.
Yep.
Stop letting them play on your insecurities and just know that you are fine the way that you are. Let's take care of what you already have.
That's all that matters.
Yes, ma'am.
Hey, y'all know what time it is.
Yes.
You can go on and on about what you need to do and how you need to do it with taking care of your teeth. You've learned a lot. You've heard a lot. If you need information, call the office. The number is on the screen. They're right there in Wyoming, Cincinnati, state of Ohio. Reach out to them. Ask all the questions that you need to ask about your mouth. I will be scheduling an appointment tomorrow for next week. I'm just telling you now.
For next week.
I'm just telling you, I'm coming. I need to say cheese, because I like to smile.
You'll be like, no, I can't have nobody else but Dr. Valarie up in here.
Yeah, Dr. Valarie Barnes. Hold on, let me get this straight. I need Dr. Valarie Barnes.
That's how they be calling too. No, where is she at? Is she not there? No, schedule whenever she is there. Thank you.
To let you know, I will be scheduling to come over there. I just need a cleaning. That's all. That's it. Hopefully and prayerfully. I'm like Courtney. Don't tell me I got a cavity. I'm running up.
I'm like, how are you talking to me like this? Are you always so threatening?
What happened see, what happened? It's two-sided. So what happened to you want her to give you the care that you need?
That's what I'm saying. She'd be like, no, she'd be like, I swear to God, I'll walk out of here. I will cause it. I'm like, no, just wait a minute.
Let me apologize in advance, okay? Apologize in advance.
Let me go. Let me let my sister. Look, let me let my sister tell you then, because yeah.
Apologize in advance.
I just be like, all right, girl. Okay, girl. How about
that? We appreciate you. Thank you so much.
Listening to this, you are perfect. I love you. You're perfect.
There you go.
There's room for improvement at all times, okay?
Yes. We have
come
to the point in our show where we're going to give our positive quotes. And since you have been our guest, we'll let you go first.
Oh, here we go. Be the reason someone smiles.
I like that.
A lot of hard stuff out here. You don't know what anybody's dealing with. Please be the reason that they smile. Give them a little love.
And because we've had Dr. Valarie on, I will say, health is wealth. So take care of your mouth, inside out. We say positive in, positive out, but make sure what you putting in is positive. Take care of your oral space. Take care of your teeth. Take care of your mouth. Take care of yourself, for sure.
And me, there's a couple of things. Be the reason why you smile. Happiness inside brings happiness on the outside. As Shanice said, one of our favorite sayings is positive in, positive out. So if you're happy, it'll show. You'll see it not only through everything else, but definitely through your smile. And at the end of the day, I truly believe this, y'all. I really do. From the bottom of my heart. It's always better to give than it is to receive. So on that note, Dr. Valarie Barnes. Dr. Valarie Barnes. Thanks for coming on. Thanks for talking to us. We love you.
See you guys next week.
Thank you, Mama.
You're welcome. Take care.
Yes, ma'am.
All right.